From ABC News, live in Times Square, Wednesday, April 20th, 2011. This is Good Morning America with Robin Roberts and George Stephanopoulos.
Turn off the waterworks if you're someone who sweats too much. It's a new procedure you need to know about that could take away your underarm embarrassment.
Permanently?
Yeah, just a little zap. But first,
on a very different note, we have some important health information this morning as well. Anyone who's had to deal with the embarrassing problem of underarm perspiration that they just can't control, well, there now may be a permanent fix, and we're going to have more on that coming up in just a little bit. Plus, well, it is one of those embarrassing topics few people want to discuss, but all of us have to deal with underarm perspiration. And Ashley Banfield joins us now to tell us about a new surgery that just might work for people who've tried everything else but still can't get the problem under control. Good morning, Ashley.
How did I get this assignment, by the way? It is one of those really annoying things, isn't it? Yeah, right, George. That's your story. Stick to it. It's one of those things that just rears its ugly head at the most inconvenient times, doesn't it? Like job interviews or first dates or Good Morning America appearances. And it's something that actually can be treated. Something has come up that might be able to help people. But I got to warn you, it is for the intrepid and the brave.
Chris Mora has it all. She's young, successful, and gorgeous. But Chris has an embarrassing secret.
I sweat profusely out of my underarms all day long, every day.
It's called hyperhidrosis, and millions suffer from it. Of course, we all sweat, even the rich and famous, from heartthrobs to supermodels, from presidents to the Hoff. Even Halle Berry on set with Ellen. And who could forget this famous scene?
Just how noticeable is this? Huh?
Sweating is perfectly natural. It helps cool the body. But for people with hyperhidrosis, it happens all the time. Their sweat glands go into overdrive.
When I'm nervous, it's the worst. I'm pretty nervous socially, so a lot of times when I'm with a group of people, I'll be sweating. When I'm in class, I sweat. The only time I'm not sweating is when I'm sleeping.
It's been terrible for Chris. After remedies and prescriptions failed, she's taking drastic action, a radical new surgery called AxiLase, a laser that destroys the sweat glands.
It's performed in an office setting, takes about an hour to an hour and a half to perform. Is the hair-bearing area.
Chris is having the in-office procedure today.
I just can't wait to wear like light-colored tight shirts. Like I always have to wear a jacket over things or a tank top and a sweatshirt like I have on now. So I can't wait to wear those form-fitting outfits.
Before surgery, the doctor uses an iodine test to map the sweat glands.
Perfect.
The operation itself takes about 30 minutes.
Kristen should be feeling just warmth now. She should be feeling no discomfort.
Dr. Mitchell Chasen says only 20 patients so far have tried it, but he says it's better than Botox.
With Botox, they're always wondering, when is it going to wear off? We have an effective treatment that can be performed with minimal and no downtime.
For Chris, the risk is worth it.
It's been about 2 weeks since my surgery, and I'm so excited to be all healed and not sweating and going out wearing something tight that I don't have to worry at all about pit stains. I'm so excited, I'm not sweating!
Good for Chris. By the way, I want to let you know it does cost about $3,000 for the procedure, not covered by insurance. And really, there aren't a lot of data involved with long-term risks at this point, so nobody knows really how long this lasts. It's supposed to be permanent. And there are a couple of risks as well, bruising, swelling, that kind of thing. And not everybody's a candidate. Back to you guys.
Okay, Ashley, thanks very much. And when we come back,